And now Dr. Israel is going to continue with his session titled Prompting for High Quality Care. This session will focus on practical ways to assure that the care you receive is consistent with your treatment plan. Dr. Israel will describe the ways systems change over time and when new initiatives are rolled out. Then he will introduce 6 prompts that parents and youth can use to assure that care is helpful. Dr. Israel, take it away for us.
So, as Ruth appropriately pointed out, there's a bit of a fire hose worth of information that we've gone through. Part of the question is, how do you organize all of that, and how is it that you're able to make sure that things are on track, that you have a treatment plan that's going to work for you and your child? What are some ways to do that? So what I have here is something that I've developed that's just a quick way to walk through what's happening right now, what supports are there on your treatment plan, and how to problem solve instances in which things may not be working in a way that's moving in the direction that you were hoping for you and your child. So this right here is the treatment planning pyramid. And at the top, we have your goals, and that includes what Idaho calls both goals and objectives. In the middle of it all, and what we really think is the core of all of this, are strengths, and strengths that are going to be developed. Then we also have on each side of the pyramid things that are anchoring what's happening, are the diagnosis, so what's the clinical focus of concern, and then on the other hand, what are the set of supports that are going to be provided around that. So if we think about looking at a treatment plan, what this allows us to do is to very quickly say, is it understandable? So you should be able to look and see, is there a long-term goal or overall outcome that you're trying to get out of therapy that's been written in your words, in your child's words, or your youth's words? That's what you're hoping for. And then associated with it, are there a set of short-term goals, things that should be accomplished within 90 to 120 days that are going to help you get there? If so, can we list them together? Then what's the diagnosis? So what's the primary diagnosis? Is there a co-occurring diagnosis that's also going to be a focus of clinical treatment? What training has the person who's going to provide care received around addressing this concern? Do they have formal training in addressing this concern? Also, behavioral health concerns and substance use concerns are many times now being treated at the same time in the same clinic. Does a person have specialty training, if that's the case, around how to address those? And then finally, what's the intervention specifically that they're going to be using to address that clinical concern? Then over here on the level of care side, what we want to know is what level has been identified in terms of the care that will be provided. So how intensive will it be? What's the setting that it will be provided in? Is this going to be an office setting? Is this going to be in-home care? Is it going to be a mix of settings? Where's it going to be provided? How many hours a week of care are going to be provided? And then if coordination is necessary, how is it going to be coordinated? Is there a separate coordinator? Is there a targeted care coordinator or a wraparound coordinator who's associated with this? Who's doing it? And who are they coordinating with? And then finally, what are the strengths? So what are the current strengths that you and your child possess? And then what strengths are going to be developed? So what is the focus in this treatment plan around what will be developed? So this is a way in one page with one sheet in plain terms where you can evaluate how the treatment plan is set up. You can identify what's been put down there and clarify Does this work in terms of helping reach your goals, right? Is the focus appropriate? Is the person who's working with you appropriate? Is the intensity of care appropriate? Is where it's going to be provided appropriate? And then are they really working to develop the positive aspects and the positive functioning of your child and the supports that can be there long-term for them to do well? Another way to think about this very same sort of prompting is to think about 6 prompts that you could use within a clinician, and this uses the words that clinicians use, so it shouldn't be foreign to them, should be very easy for them, to identify how well that assessment is translating into a meaningful treatment plan and treatment for your child. So the first thing you'd want to ask is, what is my child's diagnosis? The second is, what maintains this diagnosis? What is it that's keeping this as a concern? Why do these symptoms keep recurring right now? We know that for many concerns, actually, they resolve over relatively short periods of time. Typically, people seek care when they haven't resolved. So what is it that's keeping these concerns or symptoms continuing to reappear, right? Next, what strengths will help my child reach their goals? So what are we going to be developing together in terms of strengths? Specifically, how will the service that's being provided help my child reach this goal? And then the final 2 questions are really about this accountability. What should I expect that you will do so we can achieve this goal in 90 days or less? And then what do we need to do to achieve this goal in 90 days or less, right? And asking those 6 prompts really helps focus the work that's being done, really helps say, we're going to stay committed to working on these things. What is it that you're going to contribute to this? How is it that this is actually going to be something that's helpful in developing my child's strengths, as opposed to simply working on reducing any deficits that they might have? Really, how are we preparing my youth or my child for the life that they're hoping for, right? This is what we have tongue-in-cheek described as the Mad Libs version of the same thing. So what clinicians have that we touched on previously was something called a clinical formulation, which defines for them what the primary concern is and how they think that that's maintained over time, why they think that primary concern keeps happening with you or your child. What we want to figure out is how that changes. So how that concern gets addressed and how your child's able to reach the goals that they're hoping to reach. And so this change statement is a simple, plain English version of what you and the therapist believe is going to be the process for actually achieving your goals, right? So they should be able to put down, and you should be able to write this out based on the treatment plan, working with whoever the person or persons are for how many hours a week at whatever location will help your youth develop, and then what are the strengths that they're going to develop. The person will also help them understand and work through how, and there's the clinical focus of concern, the diagnosis makes me feel and act. And then developing these strengths and working through this diagnosis and its symptoms will help me reach these goals which are important to me. Right? This is a plain English version of a clinical formulation being translated into a treatment plan, right? And you should be able, in going through the treatment plan process, to easily fill this out. If you don't feel confident in filling this out as a result of the treatment planning process, then something has gone awry. It's something to tell you that this has gone off the rails in some way or at some place, right? And identifying where you have a problem filling these things in, or what you feel confident about in each of these fill-ins will let you know where you should be advocating for more information, or for more help, or potentially for different services, right, or goals. Now, both the treatment planning pyramid and then something I'm going to go through here in just a moment are available as black and white printable sheets, and they will be made available right after the presentation. So those will be there for you. This right here, the change statement also is available as a fillable sheet. It's available as a PDF, and that'll be made available at the end of this presentation too. So those are takeaways. If there's anything else from this presentation that you'd like us to create as a single sheet to take away, we're happy to do that too. In terms of this, this checkup, right, this is important in making sure that the treatment plan actually translates into help that's useful. So each week you could ask yourself after, you know, the week is complete or the session is complete, did I get the amount of help that was identified on the treatment plan? So that's your level of care. Do I have a better understanding of how the diagnosis makes my youth feel and act? That's the focus of concern part and the primary diagnosis part. Did we work on developing a listed strength or skill? That's the strengths development part. And do I feel like I'm closer to having these goals met, right? That's the goals part. That change checklist and things like that are likely something that Dr. Fernando, who's a later presenter, will likely address in more depth. But I just want to put that out there as, you know, those are 4 prompts that you can use each week to say, is this treatment planning process translating into something that's actually useful for my child and my family? All right, so we're gonna finish up with a couple of scenarios that I've put together. And I don't know how much each of these scenarios resonate with each of you. I have specific instances that we've encountered over the past 15 years that were used to generate these scenarios, but these are just examples of work-throughs of what we've been talking about so far. And of course, these are slightly stereotyped examples of how clinicians might present and how this process might work, but they're just meant to help us think through what are some ways that we can take actions that could be useful for our family and for our youth. Okay. So one of the things that we see in behavioral health systems is that many times they rely on people who are just getting their hours. So in this case, you might encounter an intern. They might tell you, "You're my first real client. I'm kind of nervous about this." They might rush through what they call the paperwork of completing the CANs and the treatment plan. And at the end of it, they might say, I don't know what to work on first. What do you think that we should work on? This is unfortunately in many behavioral health systems a fairly common occurrence, that you're working with somebody who's just starting their work. And so what is it that we could do using these tools to make sure that they're really still providing appropriate and effective care, even though it's early in their work and in their career? Right? Well, here's some things that we might want to think about. One of the things that we would want to do is immediately pull out this treatment planning pyramid and start asking ourselves some questions about where we're at. So one of the things we might say is, have we clearly established what the long-term goal is that's being addressed here? Also, in our short-term goals, do we have a clear link between what those are and what the long-term goal is? Are the short-term objectives, are those focusing on functioning? Are those focusing on strengths? If not, then we need to figure out how we can get those rewritten. Right? For the diagnosis, we want to make sure that the diagnosis is going to match what's been rated as needing treatment in the CANS behavioral and emotional needs section, to make sure that we're really that those things are consistent, and that that both of those pieces of information line up in terms of making sure that you are rated as having that concern as a need. If there are co-occurring concerns, and many times there are co-occurring substance use concerns in addition to primary diagnoses that need to be addressed, that may be inappropriate for an intern to be addressing, because it's a fairly complex case. So you'll want, in any case, to ask for who the supervisor is of the intern. Get that information, see if you can meet them, talk to that person. Now, there's a sweet spot in terms of finding professionals who are likely to have the skills that are most effective in terms of working with youth and families. And many times folks have identified, or at least the research literature in other fields has identified, that people who have been out of school for several years to develop a way to translate the most recent information about innovations in care, which they got from school, into how they actually work with people, are the folks who tend to be the most effective. That might be this supervisor. So the supervisor might be able to really help this intern translate what they've learned more recently in school into appropriate interventions. But you'd also want to check with the intern directly to say, what is the intervention that you're going to use specifically to identify this, to address this concern? Can you describe how long that intervention typically takes, what skills will develop as part of that intervention, if there are other people that we need to be partnering with, if this is a problem that shows up in other environments, how is it that you're going to partner with folks in those environments? So say at school, or say in community settings, maybe in a sports team, or at a church setting, or whatever it is, wherever it is that this shows up, how is it that you're recruiting other adults to be helpful in this intervention? We'd also want to look to make sure that the CANS has accurately identified what the level of care is that you need. And we might be particularly concerned if the person is new to treatment and new to using the CANS, that they might underestimate the level of concerns that are there. So if the CANS isn't accurate, it might be underestimating the level of supports that you should be receiving, especially if somebody's just doing it for the first time or rushing through it because it feels like paperwork. So you'd want to make sure that you review that with them. You'd also want to make sure that you're getting specified how much treatment is going to be received as a result of the as indicated on the treatment plan, and as a result of the level of care that's been identified. You also want to make sure that there's a focus on strengths, right? So if a person might be tempted to just move towards the things that seem to be very concerning, kind of low-hanging fruit in terms of addressing a diagnosis, but you want to make sure that they're also identifying what are the current strengths to build on, and what are the things that you and the youth want to develop as long-term resources and strengths of theirs, so that they can continue to be successful. So you can use that treatment planning pyramid then to really evaluate where this process is at, and where you might need to spend some additional time or enlist other folks, such as supervisors or other people involved, to make sure that you get the most appropriate treatment here. So some action steps you might take in this scenario is to ask to meet the person's supervisor, right now over Zoom, but other times in person. You check to see if the intensity of care feels right, And if not, you might want to consider reviewing the cans carefully. You want to check for cans item and diagnosis match, and those are the cans items in the behavioral and emotional needs section. And you want to be sure to ask what training they have on addressing the diagnosis being treated. That's one scenario. What if we have the opposite end of the spectrum, right? Where you have somebody who's been through this for a very long time, has worked in the system for the past 25 years, and sees the cans as just another piece of paperwork that's going to come and go like everything else they've seen in the system. And so the cans is just something we have to get through together. Many times a person who's worked for a long time in the field will say, my approach is eclectic. I use a variety of things that I've found to work over time. And in this scenario, they say, I don't really focus on diagnoses because what I really care about is the relationship. We have to make sure that we're working well together, and the rest takes care of itself. Well, we would use the treatment planning pyramid again to really look critically at what's happened and the extent to which that's really appropriate. One of the things that we've heard from parents when they have an experience like this is that relationships are nice, but relationships are really the starting point. And beyond a relationship, you really need to be provided something that actually changes behaviors, changes moods and emotions, and changes the trajectory of functioning that your child is experiencing, right? So a relationship is a starting point. That's a good sign. You want people to connect, but it can't stop there. We also know from the treatment literature that more accurate diagnoses are associated with better treatment outcomes because parents have told us the reason that is because you're not wasting time on things that aren't actually their core concern. So the treatment literature tells us that the more accurate diagnostic information or more accurate diagnoses are associated with better outcomes. When we talk to parents about why that might be, parents say because we need to be focusing on the things that really matter. So how is it that we might uncover that using the treatment planning pyramid? Well, part of what we would want to make sure that we do as we go through this pyramid is to say, in terms of these goals, has this person really elicited what are the things that matter to the youth and family? So does the long-term goal state what the youth wants to be able to do, not just relationally, but in functional terms? What do they want to do? What do they want to become? And then in the short term, what are the things that they're developing to be able to get there? We'd really want to make sure for somebody who's indicated that they don't focus on diagnoses, we want to make sure that the diagnosis is accurate because it should form the clinical focus of concern, the thing that you spend a fair amount of time addressing to be able to reach your goals, right? This person has said that they tend to be eclectic. You'd want to ask, well, what training do you have in treating this specific diagnosis? And the intervention that you're going to use, how does it relate to this diagnosis? You want them to be able to say clearly what it is that provides this linkage. If they are moving through the cans, again, our concern is that the level of care that gets generated based on somebody just doing a cursory cans is that it might be an underestimate of the true needs that you have, and so you might not be provided the level of supports that you should be provided. And there are some data that indicate that we're seeing fewer cans indicating that people need level 2, which are intensive community supports, than we would be expecting. So there are some data right now in Idaho indicating that people might be moving fairly quickly through these cans and might be missing some things that are important concerns. So you'd want to make sure that where treatment is going to be provided and how much treatment is provided are specified, but really focus on that level of care and how accurate the cans is. You also want to make sure that the person who's focused on the relationship has not only identified what current strengths a youth has, but how they're going to develop new strengths, right? So it might be that they focus on their relationship between the youth and the therapist, but what are they doing that goes beyond the walls of the therapy office? How is it that they're developing strengths that help this youth, your child, move towards their long-term goal, right? So some action steps that you'd want to make sure that you take in this scenario: to review the cans for the accuracy of the ratings, make sure that the level of care feels right. Should check in to see what intervention is going to be used. And just to say that I'm eclectic and use a lot of techniques is not an intervention, right? It's your perspective and it's how you approach care, but it doesn't tell you what the intervention actually is. And you need to know what the intervention is. And you check to see that the diagnosis and the CAN's behavioral and emotional needs items truly do match up. And then you'd want to drill down and say, all right, I know you're relationally focused. What strengths and skills are we going to be developing? And how are those the things that my family and my youth really care about and are really going to help us get to our ultimate goals? All right. Now, there are a lot of things that are distracting in care. There are a lot of things that come up in our lives that are difficult and push us off track from what we'd like to do. Every week, it seems like there's something unexpected that comes up, and COVID doesn't help that. But when that happens in care, that has consequences for youth and families that can be quite far-reaching. So one of the things that we've found in our research is that clinicians many times focus on a breadth of issues. So each week they might be hopping from issue to issue. And initially that seems like it might be useful. But truly effective care, from what we can tell from the literature, actually focuses intently week after week on particular concerns and developing particular skills. So we want to make sure that we define what it is that we're going to focus on, define what it is that we're going to develop, and then develop it until it's clearly and unquestionably a skill that the youth possesses or a strength that they have that they can count on. In this scenario, the therapist each week asks, what do you want to work on? They have a difficulty describing how that treatment addresses the diagnosis, since they're always hopping from one thing to another. They always seem to be dealing with a new goal or a new problem that's come up, particularly interpersonal problems that people experience during the week. And after a while, you're left feeling that no real progress is being made. So how might we use the treatment planning pyramid to help identify for us what are some things that we could focus on and how we right the ship? Well, long term, we want to make sure that the goal that's being identified is a clearly functional goal. Is it something that somebody wants to become, right? That your youth really cares about becoming. Short term, we want to make sure that there's clarity around which short-term goals are going to be addressed first and why they're being prioritized in that particular way, right? Because what it sounds like is the person who's providing treatment has difficulty identifying what priorities are and sticking with them. So really making sure that those short-term goals are prioritized and are clearly leading towards that long-term goal being accomplished is going to be critical. In terms of the primary diagnosis, we want to know that the symptoms are actually consistent with the diagnosis. If this person's, can't describe how the treatment addresses the diagnosis, maybe part of the problem is that they're not sure what the diagnosis is or what symptoms are out there. As a support, the CANs, you'd look for linkages, right, between what the primary diagnosis is identified in the assessment, and then what the CANS behavioral and emotional need item says. But the CANS doesn't ask about each symptom that leads up to a diagnosis, right? So what you might ask the therapist is, this is the diagnosis that's been provided. Can you tell me what the symptoms are that led you to that diagnosis? And see what they come up with, because that really forces them to pause for a moment and really identify what those are. Now, the diagnoses, the symptoms that lead to diagnoses are not hard to find. Like, you can go online and it's printed just about everywhere. So you can really see, like, do those things match up? And they should match up. They should match up very clearly. So if they don't, that's a warning sign there, right? You'd want to make sure that the assessment was done or redone. Have they been trained then to address this diagnosis or this concern? Somebody who's hopping from concern to concern, that might be based on their anxiety about not being able to treat that concern and not being able to tell you that. So that might be one reason that that's happening. So you'd really want to check in and say, well, what treatment have you, or what training have you received in terms of being able to provide this? And if they're not able to answer that coherently, trying to identify, is there another therapist that might be better trained at this agency that you could work with, or a supervisor who has expertise in this, who could work with you around it? In the same vein, you'd want them to be able to identify what intervention was being provided, and if they have any reference for how that intervention addresses the diagnosis. So what you're really trying to do here is to focus them on making sure that the treatment they're providing is consistent with the identified need that your youth has, right? And to reduce their level of distractibility. You'd want to check and make sure that the CANs and the needs identified on the CANs are actually consistent with what your child and your family's needs are. So you want to make sure that that's been accurately done. The level of care that comes out of that is consistent with the level of support that you need. You want to make sure then that the intensity of care that's generated is going to be enough to help you address those goals you're looking for. In terms of coordination, if it turns out that this therapist needs to coordinate care with other folks, there's the danger that there isn't clarity among all the parties involved around what the goals are and what the interventions are being used to address them. So you want to make sure that that's happening. So you'd want to check in if there's a care coordinator. You might want to check with them to see how is that being managed, and is there a way that a cross-system care plan or whatever care plan that's being used to provide coordinated care can really nail down what each person is working on and how it's helping this youth address their goals and develop their strengths. And you want to make sure that if a person is hopping from problem to problem, that one way to interrupt that cycle might be to have them focus on strength development. And what you might encounter is that current strengths haven't been identified, or they can identify current strengths, but they haven't identified what strengths need to be developed, and they haven't linked those to the goals in the diagnosis. So instead of trying to put out a fire or address some new problem or concern every week, what we really want this person to do is to be able to consistently develop new skills and strengths over time. So it might be a symptom that these are not well specified if they're not doing that. So we want to make sure that the strengths that need to be developed are well specified. Okay. So the treatment planning pyramid just gives us a series of things that we would want to think through to make sure that they're there in order to help right the ship around this. So some action steps that you'd likely want to take in a scenario like this is to ask what training this person has in addressing the primary diagnosis, identify who the supervisor or program director is in charge of things. So you can make sure that they're being provided appropriate supports in terms of being able to provide that treatment. You could ask for skill development exercises each week that would very quickly focus the therapist on what they're doing. You could check to ensure that there's a consistent focus week after week. So each session, you might gently probe about how the strengths in the primary diagnosis were addressed, right? So what you're doing is trying to keep that person on an appropriate path as they're providing that care. All right. So just so that you have some additional references, and these will be provided with a version of the PowerPoint that I believe the Federation is going to post. You know, there's the 21st Century Cures Act that provides information on data sharing and the fact that providers have to provide you with all notes that they have, all the progress notes that they use for billing, all the assessments, all the plans of care. That system development timeline and the report on how the Hawaii developed their system is online at the link there. The youth and family workbooks developed by the National Federation of Families and adapted by the Idaho Federation of Families are available at that link. And then the Search Institute is a tremendous resource, and they have the developmental assets framework there, and just an incredible wealth of information about developing strengths and assets, and a whole series of things about doing that in the middle of COVID, as well as in more normal times on their website. So those are the resources that are there. There will also be a couple of handouts that we have that will be provided to you in this PowerPoint. And if there are any additional questions that I can be helpful with, then don't hesitate to let me know. Go ahead and go through the Federation, and if there's anything else that I can provide to folks, I'm happy to do it. I've really been thankful for the time that you've given me today. I know I've taken up a lot of people's time, and I hope that this has been useful to you as you do the great work of ensuring that your family and your youth have the best life possible, and that you continue to nudge the system towards doing the work that that we know is so critical for it to do. So thank you today for this opportunity and to let me share in this time with you.
Thank you so much, Nate. I've just put out a call for any questions. Yes, and I got one right away. Can you go back to action steps slide for scenario number 3? Okay. And maybe just speak to that again.
Sure.
Or Courtney, it's your question if you want to send a little more to me to tell me what specifically you're looking for there. Oh, just wanted to review the slide again. Okay, can you do it?
Yeah, I'm happy to do it for us. The core idea here is that this person is distractible, right? They keep focusing on different things week after week. And what you're trying to do as a parent and as an advocate is to help keep them on track. And so especially those, the first 2 are kind of proactive and preventive steps, but the last 2 are things that they're consistent nudges that you're trying to provide this person so that they stay on track. And they also might be things that help gently nudge them into a more appropriate direction for care. So that skill development exercises, what are the things that we're working on? How can we work on that during the week? What did you work on and how did it develop strengths? Those are the types of things that you might be asking to keep that on track.
Okay. Checking for any other questions. Doesn't look like we have any. All right, I want to thank Dr. Israel so much for spending his day with us. That last hour for me was just full of really important information, super relevant to parents. So I hope you all found it that way too. And remember to listen to it again, as I know I will want to when you have additional time and want to pick up additional pearls that